Hi there. Are you living with tight neck muscles? Before you try to figure out how to fix it, you need to know what's the root cause of the problem. What are the contributors to your pain? That way, you can find the right treatment option for you and get lasting results. Otherwise, you'll be trying different things in hopes that they will help, like massage, heat or ice, stretching, chiropractic, acupuncture, even medications. Yes, some will definitely help. Some may help only for a while and then the pain may come back. I am sure you've tried some of these options already and you're probably nodding your head just about now. So when you don't know the root cause of your pain and trying all these different options, it's like throwing a spaghetti against the wall and see what sticks. So let's go over some of the contributors to your neck pain. First and foremost, your neck could be tight from bad posture. Maybe your walking or standing posture needs modifications, proper body mechanics. Are you staring at your computer screen for long hours and after a while you forget to pay attention to your posture? Do you have a tech neck, constantly looking down at your phone? Or maybe sleeping funny, or your pillow is not comfortable? I know my clients ask me often what pillow I recommend. And honestly, I don't have an answer. I say, if you find a pillow that works for you, just stick with it. Maybe you had an injury or a car accident, a whiplash. I always ask my clients if they had car accident, especially if they got hit from the back. Often enough, they say, yeah, but it was years ago. I have to tell them it doesn't really matter. Even if it was 10, 15 years ago, it can still contribute to your pain. Do you have seasonal allergies or maybe year-round allergies? The sinusitis may contribute to your neck pain as well. Are you clenching or grinding your jaw that you may not even be aware of? You'll be surprised how many patients I get at the office with neck pain that clench their jaw and don't even know it. They are even more surprised to feel how soft their neck becomes after I do jaw release, and even before I even touch their neck muscles. Your neck pain could be coming from inflammation. Do you have arthritis? Maybe you have cervical vertebrae issues like herniated disc, bulging disc, disc stenosis. I have to tell you, even if you may have some cervical vertebrae like degeneration, like natural wear and tear, yes, that could be a contributing factor to your neck pain, but that's not always the reason. The reason I'm telling you this is an interesting example I have. I had this case, a new patient came in, a gentleman in his 70s. And about a month and a half, 2 months before him seeing me, he went to sit down. He was an architect and he kind of missed his chair. So he didn't completely fall down, but he kind of missed his chair and just fell back into his chair. After that, he started having neck pain. So this has been going on for a couple of months. He goes to see his primary doctor who gets an MRI. And MRI shows that he has some disc degeneration in his neck, the minor herniated disc, some bulges, but nothing major. And he's sending him to see a surgeon. Now, my question to him was, did you have neck pain before that occurrence? He said, absolutely not. So I asked him to give me 3 sessions. After 3 sessions, his neck pain was completely gone. Why am I telling you this? that I know sometimes I want to see my patient's MRI reports because that gives me an idea what I'm dealing with. But just because you have any herniation or natural wear and tear, disc degeneration, that's not always the reason for your pain. Just please keep that in mind. Now, inflammation could be caused from digestive issues, which can contribute to your pain. If you have any thyroid issues, hypothyroidism, or even any autoimmune conditions, and as you may be aware of, when you have autoimmune conditions, you can have systemic inflammation, and that also could be a contributing factor to your neck pain. I know this can be overwhelming with all these contributing factors. The good news is once you determine what's the root cause of your pain, it's easier to create a treatment plan. And sometimes your treatment plan is a combination of different modalities and approaches. You're probably asking, now what? I'm so glad you asked. Now I'm inviting you to take advantage of free consultation offer. Get a free 15-minute Zoom consultation. No need to drive, no money exchanging hands. We'll go over your symptoms. What have you done so far? What worked? What didn't work? After, I will give you some suggestions, recommendations, and figure out what would be the best approach to your pain. Sounds good? Hope you like this video. Please subscribe if you like to see more videos on pain relief. And I'm looking forward to connecting with you on Zoom for your complimentary session. Please click the link in the description to book your Zoom appointment, and I look forward to connecting with you. Thanks.